Good morning. Welcome to the Best of Beaver County radio show on the St. Barnabas Radio Network. Since 1900 and counting, the St. Barnabas Health System has become a trusted name in healthcare, focusing on compassionate and quality care. Today in Allegheny, Beaver, and Butler counties, we offer a full continuum of care for our patients, residents, and retirement community family. The St. Barnabas system has developed into a visionary leader in the healthcare industry, offering an array of unparalleled healthcare services, from skilled nursing to extensive memory care activities and programs. Additionally, the medical center has world-class doctor and dentistry teams where patients can receive a full range of services under one roof that also include comprehensive rehabilitation, home care, home health, and hospice care and palliative care. Building upon its heritage, St. Barnabas continues to reach out to those in need and lives out its mission through individual and institutional services, which help the health and social needs of those in our care by increasing the quality of their life. Men and women are invited to join in the work of continuing Christian caring, healing, and teaching, and along with St. Barnabas, bear witness to its founder's reminder, God is able. While the Great American Smokeout is still a few months away, we thought it was important to get an update on those whom have started on their journey to quit smoking. We'll talk about some of the accomplishments as they return to better health, and we'll also talk about the challenges they continue to experience. Please join me in welcoming Marianne Emanuelson and Dan Tobin, both from the American Cancer Society. Dan is the Director of Marketing and Communications, and Marianne is the Associate Director for Community Implementation. Good morning and welcome to both of you.
Good morning. How are you?
Good. Dan, it's good to see you once again. We do this about once a year, right?
We do.
Oh.
And it's very nice to see you as well.
Okay, very good. Tell our audience about yourself.
Well, I am the Director of Marketing and Communications, and I cover primarily the greater Pittsburgh area, but also I do stuff all for the Northeastern United States, trying to promote the American Cancer Society, our services that we offer, and also to educate people and the public about cancer.
Mm-hmm. And how have the strides gone so far? I mean, how far are we? We always see treatments, and as far as the road to recovery is concerned, and people who are beating cancer, are those numbers increasing? More people surviving?
Way more people are surviving today than they were even just a decade ago, and that's great news. And that's a lot of that's due to early detection. A lot of that is due to people, understanding things that are preventable that you can do yourself to change and to hopefully prevent cancer. And then, of course, for people who get cancer, treatments are a lot better today than they were, quite a few years ago.
Oh, I bet surgical and those type of treatments
Exactly.
that at one time would have been considered Stone Age, now state of the art and saving lives.
Most definitely.
Yeah, very interesting stuff going on in the world of the American Cancer Society and beating cancer. Marianne, welcome to the show.
Thank you. Thanks for having us.
It's wonderful to have you here. Tell us a little bit about community implementation. What does that mean?
Yes. So for the American Cancer Society, community implementation really means bringing our programs and our services to the communities that need them. So for me right now, my focus is on the Road to Recovery program. I help operate that program and bring it to communities all throughout Western PA and also Northern Ohio. So the Road to Recovery program connects volunteer drivers who the American Cancer Society, trains. It's a very short training and it's easy to do, but they train these volunteer drivers on, what our expectations are for them. And then we connect these volunteer drivers to patients who need rides to treatment. One of the biggest barriers to getting your cancer treatments is actually transportation. Many people miss appointments or are late to their different treatments because they just can't get a ride there. So that's where community implementation at the American Cancer Society comes in with these different programs and ensuring that the communities that need them do receive these different programs and services.
So the ACS recognized a problem and are helping people in communities because a lot of folks who may be receiving treatment need to get to their treatments. They may be living alone, they may be elderly, or they may just have spouses who have to continue to work, and so they can't make it to those appointments.
Absolutely.
And so people in Beaver County, Butler County, Allegheny County are eligible for these services.
Yes. Anybody who is a cancer patient, they can call in to to get signed up for these programs, our NCIC line. And anybody in Beaver, Butler, Allegheny, most counties in Western PA actually do have a road to recovery program active currently.
Very good. And we'll talk more about that as we go along. Dan, the Great American Smokeout, that's in November?
It is in November.
Okay, so here we are in June, and we're talking about it a little bit. The number of people using tobacco products still going down?
It is going down, but it's still high, too. It's estimated about 14% of the U.S. population uses tobacco in some form or another. And what I think is interesting is we often talk about tobacco as it relates to lung cancer, deservedly so, because 80% of lung cancers can be attributed to tobacco. But what we don't often talk about is tobacco is considered to be the leading preventable cause of death in the country. Leading 1 in 5 deaths can be attributed to tobacco use, and that bridge is bigger than just cancer. So our job, hopefully we're successful in it. We definitely made strides. Is to educate people on the dangers of tobacco, to hopefully get them to realize that maybe you shouldn't use it, or figure out a way to stop.
Yeah, the Surgeon General back in the early 1960s put out the warning about tobacco, that this could be dangerous to your health, hazardous to your health. So we know this.
Yes.
We know it about tobacco. Why do we continue to fund it? Why do we continue to sell it, make it available to people?
Well,
it's a cash crop.
It's a cash crop. I mean, there's a lot of money to be made in tobacco, and so those companies obviously are trying to survive, and they're promoting it. Unfortunately, many companies, especially when you get into e-cigarettes, they market to younger populations to try to get them hooked, which is the other thing. Nicotine's addictive.
Yeah.
And so you get somebody hooked on it, and it's very hard to stop. And therein lies the problem. But you think about all the changes. You think about decades ago, like coming in through the 70s and even the 80s, and prior to that, how prevalent smoking was in TV shows and movies, everywhere. And you look at that now and how that's changed. A lot of that's due to the education. So you don't see it as much, which is a good thing.
But it's been a fight all along.
It has been a fight all along.
When they smoke in restaurants, and restaurateurs or people who smoked said, I'm not going there if I can't have a cigarette.
Yeah. A lot of that happened. I look at it this way. When they make a generic rule, though, that says you can't smoke in restaurants, everybody's on an even playing field. So if you want to go out and eat, none of the restaurants you can smoke in.
Yeah.
So it was definitely a good thing.
It's amazing because you can't make heroin legal. And all these other forms of drugs legal that are killing people, but tobacco remains on the market and available, even though they tax it high and the cost is high for a pack of cigarettes today compared to even 20 years ago. Yeah. But it's still marketable.
I look at my mother, who smoked for over 40 years, and she tried to quit. She couldn't. She was that addicted. Eventually, she did, and unfortunately, the damage was done. She also had lung cancer twice. It's a terrible thing to go through. Luckily, she made it through it, but it wasn't an easy battle. But if you would ask her, she would have loved to have quit years before she did. She couldn't, and it's that addictive. Yeah,
there's something in the sensors in the brain that cause the person who's addicted to the nicotine to keep going back to it.
Yeah, I don't understand the science of it, but boy, it is definitely an addictive substance.
Talk about lung cancer, and that's what people relate it most with, but there are plenty of other cancers involved with smoking.
Yes, there's a handful of cancers that can be attributed to smoking. And on lung cancer, I think it's important to know, too, anybody can get lung cancer, but 80% of lung cancer cases can be attributed to smoking. And I think the reason you hear about lung cancer so much is because of how dangerous and how prevalent it is. Lung cancer is the deadliest form of cancer. Let me rephrase that. Lung cancer accounts for the highest number of cancer deaths per year, more than breast cancer, prostate cancer, and colon cancer combined. It is that big of an issue. It is the second most common cancer in both men and women.
That's crazy. Breast cancer, lung cancer, cancers of the kidneys, the liver, things like that. Where are we today with breast cancer and survival rates?
Survival rates are better than they were, which is great. cancer on a whole, survival rates are better than they were even a decade ago, and those numbers keep getting better, which is awesome. When you look at breast cancer, obviously men or women can get breast cancer, but it's really, women, 1 in 8 women can be diagnosed with breast cancer, in their lifetime. And that's a high number, so it's very important to have your mammograms and get screened.
Yeah, and does it help that when prominent women get the diagnosis of cancer and they're outward and speaking about it? I know in the Pittsburgh region there have been a couple of news reporters, news anchors who have been diagnosed with cancer, and breast cancer, and they are just so forward thinking about it, and they want their story to be told because they think it'll help somebody else.
No matter the cause, and in this case, obviously cancer, anytime somebody who is high profile unfortunately gets it, but is willing to share the story, yes, that brings exposure to it, and it helps educate the public of early detection, of treatment options, of ways to prevent. So it's definitely helps.
Well, we talk about cancers, and it's okay. So it's one of those things that when the diagnosis comes along, it brings a lot of anxiety into a person's life, trauma, just to hear their physician say, "Got bad news, it's cancer," and treatments are different along the lines, but it's not necessarily a death sentence anymore.
No, not at all. Not at all. I mean, think about it. A generation ago, people didn't even like to say the word cancer.
Yeah, got the big C.
Yeah.
Yeah.
And whereas now, it is more talked about. And that, once again, that helps with the education too. But it's very, very well treatable, especially if caught early. And that's why getting screened is so very important.
Yeah. And talk about those screenings and how people get to those screenings. Marion, when the screenings come along, do you, through your program with community implementation, are you able to help those people get to the screenings in the communities?
So the Road to Recovery program is solely for people going to cancer treatments, but ACS does, promote screenings through different grants at, different healthcare systems. There are community healthcare systems in the Western PA area that receive grants to do these early screenings, these Get Screened campaigns where they're encouraging their local community members to come and get screened. So I would encourage, any community members in the area to, always, keep their eye out for these different screening opportunities. A lot of them are free or low cost for you to just go and get screened for cancer that day.
Marion Emanuelson and Dan Tobin are with us today from the American Cancer Society, the Road to Recovery, and more treatments and satellite offices available to you in many of our local communities. We'll continue that conversation as we continue with the Best of Beaver County radio show on the St. Barnabas Radio Network.
Oh my goodness, Amy, it's so good to see you.
Jennifer, how are you?
I'm fine. How are you? Is your mom doing any better?
Thank you for asking. I don't know if I can answer without being emotional. I'm sorry. I'm just tired and worried. I can't always be there for her, and it's so stressful.
I really understand. That's how I was with my dad. I'd recommend calling St. Barnabas. We did. We started with just having them come in for home care. He was so excited to see them show up. And when he needed more, we were able to move him in at Beaver Meadows, where he still has his own home-like space and excellent care.
Thanks for telling me that. I don't even know how to start, but I have to do something.
Oh, you can just give St. Barnabas a call. They have directors that can explain how it all works. Trust me, you'll feel so much better, and so will your mom.
I'm so glad I ran into you.
Visit stbarnabashealthsystem.com or call 724-443-0700 for care apart from the ordinary.
It's the Best of Beaver County radio show on the St. Barnabas Radio Network. I'm Mike Romai, and we continue our conversation with the American Cancer Society. Marion Emanuelson is our guest. She is the Associate Director of Community Implementation, and Dan Tobin is the Director of Marketing and Communications at the American Cancer Society. And Dan, when we were talking about tobacco use, and as we went to the break, we were just talking with Marion about the road to recovery. and satellite stations or offices trying to reach out to the communities in our area. You're doing different screenings in the communities around us, aren't you?
What we're doing is we provide, in certain cases, community grants and to health systems to hopefully bring screenings to underserved populations. There's a big push at the American Cancer Society with equity and inclusion to make sure people who lack the resources, maybe not be properly insured, have access to quality medical care and cancer screenings. So the obvious question is, how does somebody tap into that? And so if you are looking for those resources and need to take, advantage of those resources, there's two things you can do. One of them is visit cancer.org, which will provide that information. The other is call our 24/7 hotline, which is 800-227-2345. And we have folks that answer those phones that can help direct you to the right places, to the resources that you need.
How much did the pandemic set the system back in terms of people who have cancer or people who weren't able to go to the hospital or to the doctors, to the screenings over a couple of year period there, that maybe it was neglected and they weren't able to get the help they needed?
That's such a good point. When the pandemic happened, screenings at first were canceled. They literally were canceled. So a lot of people, a whole set of people, never had their screenings. The push now, and that's part of our Get Screened campaign, is to get people back to get those screenings done. What I think you're going to see happen is as cancer numbers come out, you're going to see a bump. Of people not just being diagnosed, but being diagnosed later stage because they missed their screenings and they never went to get them. So, if you missed your screenings or if you're due for a screening, go to your doctor and get screened.
As a lot of, when we talk about cancers, whether it's because we'll all hear from people, you probably have as well, that somebody say, well, yeah, I had a grandfather, he smoked every day for 87 years and never got cancer and died. So we always get those people. Is it genetics? Is it DNA? How does it play a role? How does cancer play a role in our makeup?
I'm not a doctor, so I can't give you the medical behind.
Wait a minute, it says here, I just gave you a promotion. Dr. Dan.
Dr. Dan, we know scientifically that certain things can increase your risk of cancer, one of them being tobacco use. We know that certain things can help prevent cancer, not using tobacco, limiting alcohol, exercising, eating a healthy diet.
Sure.
So we know that. So what we need to do is educate people so they have the tools to hopefully prevent it. Yes, some people can break every rule in the book and live to be 100. God bless those people. That's awesome. But if there's something that I know I can do in my life that can keep me healthier longer, I'm going to do it.
Okay. So we talk about tobacco use. I don't smoke cigarettes, they'll say. I don't smoke cigarettes, but you see them walking around and the lip is pumped out like that because they have the snuff in there, the little packets in there, or the folks that you're sitting behind in traffic and they roll down their window a little bit and blow this huge cloud of smoke because they're vaping in the car. So there are many different ways, and people who smoke cigars. So it's an issue. When you say tobacco, maybe a lot of people are saying, well, yeah, I don't smoke cigarettes.
Yeah, no, when I say the word tobacco and when ACS says tobacco, we mean all forms of tobacco. You really should avoid it. I mean, it's not cigarettes over cigars, over vaping, or using snuff or whatever. It is all forms of tobacco should be avoided.
Is it the tobacco itself, or is it the carcinogens that they put in it?
I think it's, once again, I'm not a medical person, but I think it's a combination of everything.
Marion, are you a physician? Can you diagnose?
Yeah, now we're Dr.
anything?
Marion over here. But again, not a medical professional, but completely agree with Dan.
Okay, so let's talk about the road to recovery because we want to get that information out to our community of listeners. How does it work and who's eligible for it?
Yes, so any cancer patient who needs to get to an appointment, who has cancer-related appointments to go to, is eligible. If they are interested, they can either go to cancer.org/drive, or they can, again, call our 24/7 number, 1-800-227-2345. And our specialists on that line will be able to direct them to the right program. The way that it works, I compare it to kind of like an Uber or a Lyft.
Okay.
So our volunteer drivers will get a notification when a ride is put in the system. So whether the patient themselves put that ride in, whether one of our specialists on our 24/7 line put that ride in for a patient, our drivers will then get a notification, and that driver can then accept or decline, or if it just doesn't work for them, they can just ignore the ride. And then that driver and patient are connected. They have their contact information, and they can proceed and do that ride, whether that's in a few days, or sometimes the rides are scheduled out months in advance. It's whatever works for the patient.
So if the patient is going to need a ride, is there a like time period, maybe a couple of weeks before your appointment, that you should call and say, I'll need it on this date?
Yes, absolutely. We always recommend giving plenty of notice, at least a few weeks if you can, and then normally if it's about 24 hours before the appointment, that's kind of like the cutoff. 24 hours is too short notice to find a ride.
Mm-hmm.
So at least a few weeks we suggest.
How much does it cost?
Completely free.
Free service.
Free
by the American
service.
Cancer
Yes,
Society.
it is fully
if you've
run.
Been diagnosed with cancer, you can get on.
Yes, correct. So it is fully run by by the American Cancer Society, but our volunteer drivers, they are volunteering their time and their vehicle to take these cancer patients to the appointments that they need to get to.
The American Cancer Society, as well as many other organizations out there, rely heavily on volunteers, don't they?
Most definitely. Nonprofits cannot operate without volunteers. We are indebted to the folks who are willing to give up their time and their talent and their treasure.
Mm-hmm. Very interesting information and statistics in dealing with the cancers and the obstacles to quitting the programs, quitting cigarettes or other things that cause cancer. As we move on in terms of secondhand smoke, when you're dealing with tobacco, a lot of restaurants and bars now have outside patios where people go. What have we found out? Are we continuing to find out things about secondhand smoke that's very dangerous? You were talking about smoking in places where you can no longer do that. I mean, doctors used to be able to smoke in the hospitals. Parents, you still see parents driving with kids in the car and smoking. Tell us about secondhand smoke.
I mean, I don't want to say equally as dangerous, because that's probably a little overdramatic, but it's definitely dangerous. You're still taking in the effects of the chemicals and the tobacco into your system, even though you're not the one smoking. Mm-hmm. So that's where personally I applaud any place that is smoke free. Mm-hmm. Not to mention even the residual effects. You go to a place. Think about it back in the day. You go to a restaurant or a nightclub. Yep, you come out, you smell like smoke. Yeah. And you don't smoke.
Uh-huh.
And it's ugh.
Yeah. Just recently was in an establishment where they allowed smoking. It was for a nonprofit organization even, but the establishment was allowed smoke, and because we're not used to that anymore, you notice it right away. Yes. You say, somebody's smoking in here, and then you're right. When you go home, you put your clothes out on the porch because they stink so bad. Yep. So Marion was talking about the Road to Recovery program and being able to take people to their appointments. The cost is taken in by the American Cancer Society, which means the ACS has to raise a lot of money throughout the year to fund these programs.
Yes, we do. Obviously, everything we do, we have to raise the money to do that. Not just these.
How do you do that?
But the research. A number of ways. Through events. Things like Relay for Life, the one here in Beaver.
Just had one last weekend. Mm-hmm.
Yeah. We also have Making Strides Against Breast Cancer, which is on the other side of the season. It's in the fall. There's other events. We rely on corporate donors and individual donors outside of that.
You still have those big balls that they have, the big galas? Not as much?
Yeah. We have some events, but not really the big formal balls, at least not here. Different parts of the country still do them, but we don't have that.
Auctions and things like that. But those are just, you can make maybe 10,000, 20,000 here or there, maybe up to 50,000 even, but that's not going to cover the costs that the ACS needs to fund all these programs.
Exactly.
Okay. So corporate giving is a big part of it.
Corporate giving as well, very big part of it.
Okay. And going forward, what do we need to know? Once again, Marion, tell us a little bit more about how people get involved with the Road to Recovery.
So again, just to reiterate, you can either go to cancer.org/drive, and that's whether you are a patient yourself who is looking for a ride, or if you are looking to volunteer. If this sounds like something that you want to get involved in and you want to help people get to their appointments, you can again go to cancer.org/drive to sign up and get involved. Or they can call our 24/7 number, 1-800-227-2345. To make sure that you are getting yourself to your appointments. They are happy to work with you to schedule out a ride and get you set up on our platform that we use to get these rides pushed out to our volunteer drivers.
Sounds like you have that phone number memorized.
You've got to. It's the one that we always give, so you've got to have it memorized.
What is it once again?
1-800-227-2345.
Very good. And Dan, as far as the American Cancer Society is concerned and the different programs that you have to offer, how do people get involved? As Marion was saying about volunteering, how are other ways that people can help?
Volunteering is huge, whether it's be at an event, whether it be a driver, whether it be for our Cancer Action Network, which is our advocacy wing that works with local politicians and state politicians and federal politicians to try to enact change. And you get involved the same two ways, cancer.org or call the 800 number, which is 800-227-2345.
Mm-hmm. And it's important for everybody to know these things, important to reach out to the American Cancer Society and to find out the information. There's tons of information available out there to people, and all they have to do is reach out to you.
Exactly.
Okay. Going forward into 2023, the Great American Smokeout is happening November.
I don't know the actual date. It's Thursday. It's usually the Thursday before Thanksgiving.
Okay. And if there's one bit of advice that you can share with people about early detection and screenings, what would that be?
It is to get screened, not go work with your healthcare provider. The other is be your own advocate. If you feel something wrong with your body and you're not in the recommended screening age yet, don't let that deter you. Be your own advocate and get screened.
Not to make light of it, but at my age, if I feel something wrong with my body, that could be a daily. Dan Tobin, thank you so much for being with us. Always good to talk with you.
Thank you.
Marion Emanuelson, thank you. It's nice to meet you and continued success. It's important to be in the community, and the American Cancer Society is there. All you have to do is reach out to them. I'm Mike Romai. It's the Best of Beaver County on the St. Barnabas Radio Network. Stay safe, be well, and coming up next, we'll have a special program next week as well on the Best of Beaver County.
Thank you for listening to the Best of Beaver County. St. Barnabas is pleased to have provided content and sponsorship for the program. Tune in this Sunday at 11:30 for an encore presentation of today's program on Beaver County Radio. And next Thursday at 11 for another edition of the Best of Beaver County on WBVP, WMBA, and 99.3 FM.